board, the staff, and our state affiliates, please know that the welfare and safety of you, your teams, and your families are our utmost concern. It's my honor to welcome you to today's SBHC peer-to-peer listening and learning session. We're glad you've joined us. We also have representatives from our state affiliates, state program offices, and Alliance board members listening in on the call. We're hosting these listening and learning sessions every week. While the Alliance doesn't have the answers, nobody does. We want to provide support to SBHCs by connecting like individuals and facilitating peer-to-peer virtual meetings where SBHC sponsors and administrators can convene to discuss and share how they are responding to COVID-19. Please know that there are no right or wrong answers to the questions we're asking today. We're interested in learning more about your individual experiences and opinions. Now I'd like to introduce our three facilitators for today. Andrea Shore, our Vice President of Programs, Tammy Alexander, our Senior Director of State Relations, and Paula Fields, our Director of Programs. I'll pass this on to Andrea now. Thanks and stay safe.
Wonderful. Thank you so much, Robert. As Robert mentioned, I'm Andrea Shore. I'm Vice President of Programs here at the Alliance and really welcome all of you to joining today. This is our first listening and learning session, so we're really looking forward to diving into discussions with you all today, and as well as looking forward to your feedback on any ways we can improve these sessions for our future sessions coming up. We are the School-Based Health Alliance, and we work to improve the health of children and youth by advancing and advocating for school-based health care. Next slide. We believe that all children and adolescents deserve to thrive, but too many struggle because they lack access to healthcare services. School-based healthcare is the solution, bringing healthcare to where students already spend a majority of their time in school. Up on your screen is a quick snapshot of our agenda for today. I'm going to run through where we have COVID-19 resources on our website, go through a few housekeeping Zoom reminders, and let you know how we're going to follow up to today's session. Then we'll dive into the discussion questions for today and spend a little bit of reflection time and share with you upcoming session dates. The Alliance remains open and working to meet the new needs of our field. For more COVID-19 specific information and updates for school-based health centers and Alliance efforts, please visit our website. You can see a snapshot here on the screen of a sample of some of the resources that we have up on our webpage right now. So a little bit of housekeeping for today. As you all know, we're in Zoom and we are recording today's session, and we're going to post it to our website after so that others can listen in. For now, all attendees are in listen-only mode, and we're going to invite you to participate in a variety of ways of communicating with each other today. We're going to ask you some questions through a software platform called Menti, and we'll welcome you to use the chat box throughout the entire session where you can share your thoughts and ask questions. You can also respond to questions by using your phone. Using your audio. Here is a snapshot of the Zoom control panel on the webpage up on your screen. Hopefully you'll see at the bottom of your screen the raise hand. That you can use at any point in time, and then we can unmute you so that you can share verbally any of your thoughts and ideas and questions with the group as well. So the chat box is always going. You can raise your hand at any point. We'll be monitoring that. And then we're also going to ask you facilitated questions in Menti. Please recognize that we have more than 150 people on Zoom today, so we're going to do our best to manage this. And we're going to hang on to all of the questions and comments in the chat box so that we can use it for follow-up conversations as well. Okay, next slide, please. Thank you. After today's call, we're going to send up a follow-up email to all of you containing the slides and a link to our COVID-19 resource webpage. We'll share a recording of the call on the website, as I mentioned. And then we're also going to send you an email inviting you to join a Basecamp group, which allows for continued collaboration and resource sharing. Basecamp is a real-time online communication tool that helps teams stay on the same page. It fosters collaboration so we can share resources and send messages to each other, ask questions, etc. So the email link is going to give you an opt-in option to the Basecamp group. And we're also going to attach a brief guide with tips and tricks for using Basecamp. Okay, so today's theme, as you all know, is telehealth. In order to get our discussion started in a moment, we're going to ask you to please pull up a new web browser on your computer or take out your phone. We're going to use this website, menti.com, and in a few moments, you're going to see our screen switch to the Menti platform, and it's going to give you a code at the top of the screen. You should see it here now. So I'm going to give everyone a couple of minutes. This is the platform we're going to use to share a lot of thoughts today. So please take a few moments to pull out your phone or pull up a web browser, and you type in the code at the top of the screen. Then I'll prompt you to get started. Oh, wonderful. I see names already coming in. This is great. So you can see all of your peers who are joining today. This is wonderful. Thank you. I'm going to give a little bit more time. I see 28 or 30 people we've got. Great. I'm going to give another minute so we let everybody get a chance to get their name in here. I see the numbers going up. This is great. Okay, the numbers are still going up a little bit. Sorry, just want to make sure everyone has the time to get in because this is our main way for getting our discussions going today. Give one more minute. If you do get stuck and are unable to eventually get into Menti, you can feel free to chime in using the chat box as well. We do encourage as many of you as possible to please get into menti.com. Okay, I think we're going to move on in Menti. Okay, we're going to ask you a couple of just questions about who you are, your organization, where you're from, just so we can get a sense of who's on the call today, as well as helping us take a look after at analyzing some trends in the responses today. So please take a few moments to add your organization. And if you were unable to get into Menti, please do add your organization in the chat box. Wonderful. Thank you for entering the chat box too. I see that. Okay, let's go ahead and move on to the next question, please. Please enter your position in your organization. Wonderful. Such a great diverse range of participants here from mostly from school-based health center sponsor organizations. Thank you. Okay, for the sake of time, we're going to keep moving on. It's okay if you miss one of these. Let's go to the next one, Emily, please. We're going to ask for your zip code, and then the next one will be your state. So we'll give you a few seconds to do this one, and then we'll move on to your state. Okay, and let's go ahead and move on to state, please, Emily. Thank you. This is fun. This is the word cloud where we get to see where everyone's from. Wonderful. Okay, we're going to move on to our first question for today. Before we dive into asking you about telehealth, we just want to give you a moment to please share with a few words in Menti how you're feeling about your work in school-based healthcare. I see frustrated staying large in the middle. And that means if something's one of the largest words, that means it is a repeated response. So thank you for sharing all of this. Chris Coley, I'm glad to hear from you that it's feeling great. That inspires me. Wonderful to hear that. Thank you. Okay, thank you all so much. We just wanted to give a moment for you to share and express some feelings during these challenging times. Okay, we'll go ahead on to the next question, please, Emily. So this is our first question today related to telehealth. Could you please take a moment to share what are your immediate challenges, concerns, or fears related to COVID-19 and telehealth in school-based health centers? Resources and funding rising to the top. I see some concerns in the chat box, concern we're missing some of the kids who need us the most. Practice for many providers. Yeah. PPE rising to the top on here and contacting clients. Great. Thank you so much for sharing this. So what we're going to move on to next is sharing some of the strategies that some of you are using or embarking in. We also have many guests on today that we've made sure to invite who have been implementing telehealth with school-based health centers for several years so that they can also chime in and share some of their experiences and practices and protocols. And we know many of you are diving into this for the first time and really have some exciting innovations and new strategies. So we really encourage you to share anything that you're trying related to telehealth today. That's what we're here for, to share with each other. So not all of these concerns and challenges are going to get answered from our discussion today, but we're going to move into the facilitated conversation piece. And I invite you to please respond to the question at the top of your screen. First, we're going to talk to you about operations, and then we'll talk a bit about clinical care. So if you could please share, what are you doing differently in school-based health care telehealth operations? This could be brand new startup or expansion of your existing telehealth work related to COVID-19, please. And again, feel free to enter into the chat box, please, if you're not in Menti. This is where we really want to make sure to hear from everyone. Okay, I see some people are starting to mention connecting directly to students at home via telehealth. And it looks like several of you are saying both for primary and behavioral health care. If you can start to expand on sharing that in a little bit more detail in the chat box, we'd love to start calling on some of you, or raise your hand, please, in the raise your hand prompt at the bottom of the screen. We'd really like to start to hear a little bit more about how have you started to add primary care and behavioral health care, especially if you were not doing it before. What is the version that you're doing now? Oh, I see Elizabeth Lemaire has said that we've added direct asthma outreach for telehealth and for behavioral health appointments. Elizabeth, would you be willing to be unmuted and share a little bit more about what you're doing there? Matt, if you can unmute her, let's see if she can share some information.
I just unmuted her.
Okay.
Hi there, can you hear me?
Yes, thank you, Elizabeth.
We have had telehealth up and running for the first time for a little over a month now, and so everyone has been trained in it. I just yesterday went through and analyzed all of our school-based health center telehealth appointments to see what's working and what isn't working. I saw that the direct outreach that we're doing to all of our asthmatics is really effective. So whether we're having a medical assistant call a patient or family to then set up a telehealth appointment, or it's the provider directly calling, that's working really well, and those patients are receptive. We've done something similar for all of our behavioral health appointments. I will say what's not working well is we've actually, we created a Google Text and a Google Voice number just for school-based health centers, and we've been doing tons and tons and tons of outreach directly to students. A lot of our students just aren't interested right now, but I think these target populations of, like I said, the asthmatics and the BH, that is working well.
Thank you. And Elizabeth, what platforms I'm sorry if I missed, if you shared, what are you using for?
Yeah, so we're since we already have Microsoft Suites, we're using Microsoft Teams, which works pretty well, and we're using the Microsoft Bookings app also to book the appointments, and so those we have found work really well because with Teams and with Bookings, the provider email address isn't shared. It's pretty easy for the clients to join. We're still working out some kinks with that, but that is what we've been using at this time.
Wonderful, thank you. I'm going to call on Katie King, who's here with us from Mecca University of South Carolina. I see you put in the chat box that you had previously run primarily telehealth to students in schools, and you've pivoted to using Doxy to connect to your patients. Can you unmute yourself, please, and share a bit more?
Sure. Can you hear me?
Yes, that's great.
Great. Yeah, so I think, we were in a position, we're based out of a university academic medical center and a large center for telehealth that serves the state of South Carolina. And our school-based program does include some in-person care traditionally, but is primarily telehealth based. And typically those visits are cart-based between a provider and a school nurse serving as sort of a telepresenter with our students. And we see kids for chronic disease management and acute healthcare needs, and of course some behavioral health. So we more recently have pivoted to reaching out to those students that we provide chronic disease management for, and setting up Doxy.me visits. We're using that platform because it's part of what we're using in our entire health center for ambulatory visits. And because we have an instance of it owned by our institution. It's also just pretty easy for users. You just send patients a link. I will say most of our families are doing better with kind of a same day appointment because people's schedules are just a little chaotic right now, I think, with having a lot of kids at home. But we are doing some scheduled visits. And it's taken a good bit of outreach to our families to get them involved. But I think it's working fairly well.
Thank you. I see Melanie Bonjour in the chat box. Thank you so much for your information. Do you mind unmuting yourself and sharing a bit more about how you've added behavioral health and medical visits?
Sure.
And the outreach you're doing? Thank you.
Sure. I guess I'm unmuted. Yeah. So we are immediately started implementing telehealth across our whole organization. I belong to an FQHC, so it was new to us, but through our school-based health centers, and we are using our electronic health records, ECW, to do telehealth visits. We've done audio visits as well as video and audio visits. Our behavioral health providers have been very successful in reaching out to students and connecting with them and scheduling visits. I think one of the successes that we've had is strengthening our partnership with the school district nurses who have also feel a little lost in connecting with the kids. And so they have worked with us to communicate that we're available, and they use robocalls district-wide. They have contacted the students directly. We have been allowed to post on the students that Google, whatever it is they're using to do the e-learning. We post messages on their websites, and then we're also doing direct patient calls. So the behavioral health has worked fairly well. Medical is a little bit more challenging. And initially, what we were being required to do through our FQHC is to sign the students up via the patient portal. But one of the challenges we had and concerns we had with that was that if a student was signed up through a patient portal, the parent could have access to all of their medical visit information, whether it's past or future. And our concern was the students who may have confidential visits. And so we worked with our IT team and who worked with consultants from eClinicalWorks. They called it to scrub the patient portal records and limit what is on the patient portal for patients 13 to 18 years of age, so that if a parent did have access to it, those confidential visits would not be posted. So we were able to implement that, and we're being more successful in reaching out to the patients. For the medical piece, the one thing that we are doing now is we are looking at all of the enrollment forms that we have on all our students that are enrolled in health centers, and any student that has a documented, like say, asthma or healthcare issue, their asthma, they've had eating challenges, medical conditions, that we are reaching out to them with I'll say a courtesy call, and just saying, we want to let you know that we're checking in to see how you're doing, and this is how you make a telehealth visit. And it's increasing our patient visits. Been a little challenging. I'm sure everyone's experienced that, but we are making headway.
Wonderful. Thank you, Melanie. I have two next comments I'd like to hear from. Jane Hamilton, if you could expand on what you put in the chat box. And then also Jasmine asked whoever wrote in the Menti box that they have created a telehealth wellness center. Could you please raise your hand so after Jane's done, we can unmute you? But Jane, if you could share a little bit more about what you're doing up at Bassett, that'd be great. I think you're still muted, Jane.
How about now?
There you go. Yes.
Okay.
You talked about your
Yeah.
EHR portal would be great to hear about. Thank you.
Yeah, so we for years have attempted to get kids signed into, we use Epic, so MyChart, and our efforts have been fairly lukewarm, to put it mildly. And we dealt with the adolescent challenge. The way it works for us is that the adolescents need to give their parents permission to look at it. Now, if the parents are right there when we're signing them up, that's a little more difficult. But we found we probably only had about 5% of our kids with activated portal access. So we have really engaged the army of our staff. Everyone got remote access very quickly. Within the first week of us shutting down, everyone is working from home, is able to get into the HR, email, all of those things. So we, all of our staff and mental health workers, the dietitian, our care coordinator, everybody, and our office assistants are calling and activating or helping families activate 3HR. Problem is we are very rural and not everyone has good, they have no broadband, they have poor broadband. They seem to have devices, but we've increased our activation rate to about 37% from about 5%. So we feel like that's a real win. We have one site that has a 80% activation rate. We have on the lower end more like 15%. So we continue that work. We feel that'll benefit us, going forward, even when we're all back, and we try to explain all the benefits to families. And when we're doing it, we'll help the entire family enroll. So it's not just benefiting school-based health, but our entire organization. So I think that's been, a real challenge for us, but I think has made us all realize that we need to spend more energy on that when we're enrolling patients right up front, when they're in kindergarten or they move in. So, but it's gone well. The other thing I mentioned, and I just wanted to, I added in the chat box, is we have done a couple of teledental visits, which I was on with our dentist yesterday. I mean, it's nothing more than she's talking families or patients through what to do. Many of them she's seen. She was about to do some restoration on, then everything got closed down. But we're happy that they're at least thinking to connect with us and to her when they have more acute problems. So.
Wonderful. Thank you, Jane. I see that Jessica Colvin raised her hand. Maddie, if you can unmute her, please. I'm guessing, Jessica, you have a response to Jasmine. Please share.
I just unmuted her.
Great.
Hi, I'm Jessica Colvin. I work in Tamalpais Union High School District in the North Bay, in the Bay Area, in San Francisco area. And we just launched a virtual wellness website and wellness center where students can get information, crisis information, health education, connected to counselors. And then we also do a wellness community Zoom room every day for students to drop in. So we are implementing this. Feel free to check it out. It's really exciting.
Wonderful, thank you. And when we do send that Basecamp invite after, we'd love for you to share things like that. And we can actually upload resources and share templates for consent forms, etc. So thank you so much for sharing, Jessica. Okay, great. I see some questions about consents and handling permissions. Is there anyone particularly on our panelists who want to share how they gather consents for telehealth and what people might need to pay attention to if they're just starting this up for the first time, as some of the essential how-tos for gathering consent?
This is Jane. I can just mention a couple of things. One thing that we did this year prior to all of this, and we've been doing telemedicine for a few years, but we worked with our legal department and we have a blanket telemedicine consent that has no end date on. So that went out with our, what we call re-enrollments or updated enrollments. And we tried to simplify it as much as we could. So, and we've had a pretty good return on that. So we're really quite happy with that, because most of these visits are happening at the moment with the kids in school, and it was very difficult for us to get a consent form out to parents if they hadn't already filled one and get that back. Right now, when we aren't exchanging paper, we actually have what we call a smart phrase right in Epic that the practitioners use, go over with patients and use that as a consent.
Great, thank you, Jane.
This is Lori Swanson. I work for Every Child Pediatrics out of Aurora. We have a similar setup now that we're doing telehealth, where we just get a verbal consent over the telephone in the beginning of our visit. So basically, we kind of try to communicate the risks to benefits of telehealth visit as opposed to an in-person visit, including the fact that there could be a potential loss of confidentiality or a break in HIPAA. Just the risks of not being able to do vital signs or have a physical exam, and that there could be missed diagnosis. And then after explaining that, then we get a verbal consent from the parent and document all that with a quick text in our visit.
Wonderful, thank you. Jane Highland, I see you're on here. We can unmute you from CHC Inc. I know that you had some consent information as you've shifted to more school-based telehealth. Would you mind sharing? Maddie, can you unmute her?
Yep. I think it's pretty similar to what others have shared. In Connecticut, they waived the need for the written consent. So we are now able to do telehealth with oral consent, and like the speaker prior, we've built that right into the provider template within our ECW electronic health record. Seems to be working quite well.
Wonderful. Okay, Dr. Balaban, I'm going to call on you to please share. She's recently shared on our telehealth base camp some consent, sample consent forms and experiences. If you could please share. I think you are still muted.
Sorry about that.
There we go. Thanks.
I use the this is Monique Valabon. I use the American Telehealth Association guidelines that was endorsed by the American Academy of Pediatrics in 2017, I believe it was. Yeah, 2017. And included in that, there are several elements that we must have. Well, during the COVID pandemic, many of those requirements are being waived. We felt like it was best practice to include those elements. So I developed a template for our medical assistants to use prior to the visit. They call them, go through the template, which is essentially a narrative, and with blanks for their name. And then they document that in our clinical note. They copy and paste that template into the clinical note and then send them an email with the telemedicine link. So then they can, and instructions how to download the app. So the essential elements include the difference between telemedicine and in-person risks and benefits. And then the other thing that you have to talk to them about is how their medical information will be stored, and that it will continue to be confidential as it was, be kept private and confidential as it was prior to using telemedicine, and that it's not audio recorded. And then the next piece is that you have to make sure they know they're going to be billed for it. So I did share that template that I made on the Basecamp. I have it in Spanish and in English, and I also included the reference on the bottom with the ATA guideline link.
Wonderful. And I can move that over to the new Basecamp with this larger group of people as well. That would be great. Thank you. Okay. I think we're going to move on to our next question, and then because we're cutting into some clinical issues too, and then we'll leave it open for conversations and in both operations and clinical areas. So if you could just take a moment, and I'm going to keep taking a look at the chat box, see what else is coming in, but could you please share on Menti what you're doing differently in school-based health center telehealth clinical care related to COVID-19? So we were focusing a little bit more on operations before, but if there's anything else to add here, specifically about clinical care, perhaps some policies, procedures, different, that would be fantastic. And then we'll see if any new themes come up. This is very interesting. Could the person who entered using a camera to assess skin raise their hand with the raise a hand function? Would love to unmute you and hear what you're doing there with some of your creativity with exam. I did see some questions in the chat box about whether school physicals are happening. So hearing some examples like that would be great. It looks like it's Lori. Lori, go ahead and chime in, please, what people are feeling. Do you mind sharing? I think you are still on mute. There you go.
Yeah. Yes, we're just using the camera. Dermatology visits seem to work pretty well. You need good light in order to be able to assess the skin, but I did recently do an eczema visit and was able to assess pretty well. I think you can involve the parent some, even including a flashlight to open up the mouth and look at the throat, see if there's any dental problems going on in the mouth. Those are things that can be done. I'm a little hesitant to do an abdominal exam that way, but I think worst case scenario, if the parent pushes the belly and the kid is just grimacing, then we probably would send them to the ER. But I mean, it would kind of give you an idea if it's an acute appy or not. Those are things that I worry about assessing through telehealth. But I think there's more than we think you can do. You have to just get really creative with that physical exam. In terms of physicals, I think the AAP is working with Medicaid for reimbursal on a two-step physical exam, where the initial piece is done where you do more like developmental screenings or mental health screenings, kind of history, update of all that, refilling medications, all that on the first visit. And then there's an actual later date in which in-person visit is done. And that would include the hands-on portion.
Great, thank you, Lori. Chris Colhe, could you please share a bit more about what some of the new clinical or what you've been doing as some best practices up at Bassett, please? Oh, and I think we have to unmute you. Sorry. Maddie, can you unmute Chris?
Just unmuted him.
Okay, great. Go ahead, Chris. Oh no, we can't hear you.
Chris, I allowed you to talk. Will it let you unmute yourself? It doesn't seem to be working on my end.
Oh no. Okay, he's adding some really great information in the chat box, so we will have those records. Chris, type if you do notice anything different. Let us know. We'll try you again. I do see also again, Katie King, if you could please share a bit of what you've been doing, what you recommend with if you're doing any physicals and other ways that you talk about touch points with the patient over time. If you could share a bit.
Sure. And I will say, to a certain extent, telehealth is not new to us, but in our school-based program, we are more used to being able to do more physical exam using the technology that we have in school nurses' offices. So this kind of direct to patient is a little bit different for what we're used to in school-based health in our program. And I think it really takes, like folks said, being creative. I will say we've also converted our ambulatory visits within our typical academic medical center clinics in the same way. So usually what that means is, some of the techniques people have discussed, really asking parents to help shine light, I typically ask parents if they have a scale, could they weigh the child, show me the scale. Sometimes that means for smaller children saying, can you get on the scale? Can you tell me what that is? I won't tell anyone. Now hold your child. What does that say? Some families, either they have a blood pressure cuff or a grandparent has a blood pressure cuff. So just kind of taking stock of what they may have, and sometimes it's surprising to you. There's actually a function on most iPhones that allows you to measure a height if the child will lay on the ground. And so sometimes that works if they don't have a measuring tape for a height, if that's necessary. Otherwise, a lot of things can be done just sort of talking through and kind of coaching people on positioning to see things like rashes and, like folks said, in the throat and things like that. I did a rash this morning and I just had to kind of say, okay, can you move a little to the right now? Everyone hold really still, maybe anchor your arm that's holding the phone on the table or the floor, and that helps with kind of pixelation. If everyone can be anchored, it helps the camera focus and have a stable moment to focus. And then I think what I was speaking to on the chat was, remember some things, the great thing about pediatrics, obviously you want to have a really low threshold for sending people to in-person care, and folks are talking a little bit more about, of course, acute abdominal pain. Maybe you want to send that in. Obviously any trouble breathing or anything like that. We don't want to completely think we're going to be able to treat everything we do in person. But some things over time, asking people about what the symptoms are now. Okay, you know what? We could touch base tomorrow and you can tell me what the symptoms are tomorrow. And having more touch points over time sometimes helps you have more data points to put the story together, because most things in pediatrics are going to, get worse, and then you can coach people to go to in-person care, or they're going to start to resolve and sort of declare themselves. And so that's a technique sometimes we use is, all right, let's take, a couple puffs of your inhaler, and then I can check back in with you in 20 minutes. And I can check back in with you in 2 hours if you have that kind of flexibility. And if anything looks like it's going in the wrong direction, of course, send to in-person care. So that's a technique that we use fairly often. And it obviously does not completely replace in-person care. But thinking through that, things like titrating ADHD medication, I can check in with you, in a few days to see where that's working. Whereas in traditional care, we might have said, I'll see you in a month. And so sometimes those increased touch points can actually enhance care and make it more efficient. But I would just say for folks that are new to this, try and be creative, and certainly employ families to help you with things like physical exam, but also set your threshold fairly low to send people for in-person care.
Thank you so much, Katie. Chris, it looks like you were able to unmute yourself. Chris Coley, if you could chime in and please share.
Can you hear me now?
Great. Yep, we hear you. So
a couple of comments. The person who was talking about abdominal pain, if you're really concerned and you think it's appendicitis, or you think it's pyelonephritis, or if you think it's PID, having the patient do the jump test in front of the camera, where you ask them to jump to touch the ceiling and they say, well, I can't do that. And you say, well, just try. And if you get them to do it twice, well, then they probably don't have they might have constipation, but they probably don't have a peritonitis, because they won't jump twice. They'll jump once and they'll say, no, I'm not going to do it again. So that's one additional thing you can do in front of the camera to assess that. But I agree with the last speaker that you do have to have a low threshold if you can't feel the belly. One of the things that we're starting to do now, because this is the time of year where our seniors are moving off to college, and we like to do senior transition visits where, because they're coming to the end of our care, we want to make sure they have enough medication, birth control pills, that they have their inhalers, that they are lined up with another provider, so that if in 6 months they need care, that they can, they can get right in. And so that can almost always be done just based on history and reviewing everything in the chart. It's not the same as doing a physical exam, absolutely not, but I think it does a reasonably good job.
Thank you so much, Chris. Two other clinical questions that have come up. If anyone could raise their hand, please, and be willing to share. Does anyone have any practices that they recommend that they're finding successful around adolescent confidentiality, especially while they're at home now? I see on the screen that someone mentioned partnering more with the parents of our secondary level students. So would be curious to hear how adolescent confidentiality is working out. And then also if there was anything else to share regarding the extent that school physicals are possible. Let's see, Maddie, if we keep our eye on if anybody raises their hand.
Elizabeth Lemire raised her hand and I just unmuted her.
Hey there. So yeah, we always have our confidential visits top of mind because we do, with our high schoolers, have a lot of students who come to us for confidential care. So things that we've been doing for that is in our EMR, we, before coronavirus times, we designate student cell phones in the chart as well as parent cell phones. And typically for our students that we're seeing for confidential services, we have their personal cell phone. So we've been utilizing text messages and phone calls to let them know that we're still available for these services. And then doing virtual visits when they're, reaching out. One of the things that we have run into, of course, is how can a student have a private virtual visit when they're stuck at home with their parents? And so, we're trying to work out how to do that. Some students are taking a walk. And we are still seeing in our community health centers some in-person visits. We're doing well visits, non-sick visits in the morning. And so for some students that need to get their depo or need an STI test, if they're able to get out of their house, we're seeing them during our well times for that. And then we're educating our staff who are helping with kind of the front desk in our community health centers about how to bill for these school-based health center patients. We can bill Medicaid for these school-based health center patients for confidential visits, but we came up with some specific policies for how to handle, if they don't have Medicaid, they're coming into our practice or we're doing it over the phone, how are we going to handle that billing? So we came up with a procedure for our staff who are not so familiar with the confidential visits. So it's definitely been a process, but I think kind of constantly educating our staff and reaching out to our patients to just let them know that we're available.
Thank you so much. Oh, I see here, Brittany Rogers asking, how about sports physicals? We'll do this as our last question, and then we're going to move on to wrapping up. But we promise the conversations can continue to happen through Basecamp. Anybody else want to chime in on sports physicals? She's saying students that participate in athletics are required to receive one. Arkansas Governor and Medicaid have made telemedicine a billable service for the state. Anyone want to share how they're handling sports physicals for the upcoming school year? I see Kate Connor, if you could unmute her.
Yeah, sure. Hi, can you hear me?
Yes, great. Go ahead, Kate.
Hi, I am in Baltimore at Johns Hopkins, and we have gotten telemedicine up and running and are really excited about it. We're in the process of advocating to be able to bill for preventive visits by telemedicine for Medicaid. I would say personally that I don't think that the physical exam requirements of a true sports physical for like a middle or high school athlete could be met by a video visit. And I'd welcome other folks' thoughts on this because we've been really thinking through this hard, but really in order to do an adequate cardiac and probably you could do a musculoskeletal exam over video, but the cardiac exam in particular, I don't think can be done adequately over video. to a patient's home. So we are not doing those currently, but trying to plan for how we'll get a bunch of them done if we open on time.
Wonderful, thank you. Was there anyone else, Maddie, who had raised their hand?
No, I believe that was it.
All right, thank you all so much for sharing. I know we could talk and talk about this, and we would love your thoughts on any additional conversations that would be useful for the field. So if you could please take a moment, we're going to wrap this up, and we will also, I forgot to mention earlier, we will be drafting up a report with the thoughts and what was shared today that we will also send out to participants. So we're going to have lots of resources for you as follow-ups to today's session. If you take a look back on your Mentee screen, we're going to ask you a few closing questions. And the first one was whether this session was useful for you. Sorry, I might have unmuted myself. Emily, do you mind going to the next question, please? If you could please rank the following topics based on your interest in seeing them covered in future listening and learning sessions, that would be great. We've got 7 options there, and then we'll have an open-ended question next for any other topics you'd like to see us address. Okay, it looks like reentry and startup are definitely rising to the top. And Jessica, yes, we will definitely give a copy of today's presentation. We're going to send a follow-up email that will include today's slides, a link to where you can find this recorded session on our website, as well as a second email with an invitation to the Basecamp group. Okay, we're almost at the end of the hour, so let's go ahead and ask if you have any additional topics or questions you'd like to see covered in future sessions. Thank you, Lizette. Thank you for joining. And just as a reminder, when we do send you Basecamp as a invitation, that's where we can post resources to share with each other, templates, sample protocols, excuse me, and practices, sample consent forms. I see consents popping up a lot, FERPA, so we can share each other's practices directly on that website. Okay. And we're just going to move on to the last question now for the sake of time. Thank you everyone for bearing with us for the last moment. Do you have any suggestions for how we facilitate our next listening and learning sessions based on how we experienced it today with our first session? How we operationalize this? Great, thank you for these comments. Okay, I'll just give another quick few seconds. Okay, I think Emily, let's go ahead and move on to our final slide, just to show you our a reminder of our upcoming session dates. And we'll send out an e-blast to everyone through our usual e-newsletter with each week's date so that you can register ahead of time. And we will announce those week's topics. Thursdays this week is focused for clinicians on telehealth, and then we will move on to some new topics the first week of May. So stay tuned and keep an eye out in your inbox. Thank you all so much for sharing today, and we'll take a look at all of your feedback. Really appreciate it, and we hope to see you on an upcoming session. Thank you.